Dr. Ramurthy, Dr. Bhattacharya, distinguished delegates, dignitaries on the dais, ladies and gentlemen. I am greatly pleased to be here at the 74th Conference of the All India Ophthalmological Society. It is indeed an honor for me to have been invited to be the chief guest at this prestigious event, and I wish your deliberations all success. I understand that AIOS, which was established in 1930, is the largest life member eye doctor association in the world, with 18,000 ophthalmologists as its members, and that it is the parent organization of all the state and subspecialty eye societies in the country. I am also very happy to learn that AIOC is the largest annual scientific conference of ophthalmologists, with more than 10,000 delegates from India and abroad. The conference also brings together trade representation of 200 ophthalmic companies from across the world. I am told that simultaneously there are scientific programs running across 15 halls throughout these 4 days and a trade exhibition covering 10,000 square meters. As such, it provides a very valuable platform for domain experts to come together, share their experiences, and learn from best practices in the field. As specialists, you would well know that ophthalmology is a highly specialized field of medicine which has huge societal value, especially in a country like India. It is an interdisciplinary science that responds to varied eye-related disorders. Since the eye is a very delicate organ, eye care requires specialized knowledge of its complexities. As such, the ophthalmologists play a crucial role in attending to eye disorders and striving to eliminate all of them. It is said that ophthalmology could be the discipline which has benefited the maximum from technological advancements. According to scientific journals, this field of medicine has seen major successes in enhancing cataract surgery, retinal prosthesis for the blind, non-invasive retinal imaging, refining glaucoma surgery, gene therapy for ocular diseases, and treatment for diabetic macular edema. Needless to say, ophthalmology is a highly dynamic science, and its practitioners have to keep an eye, as it were, on these advances. Yet there are pressing challenges before the eye specialists, more so in the context that the majority of the visually impaired live in low-income countries, where there is both a deficiency and inequity in access to eye care. The other issues which have been identified by domain experts include inequality in the distribution of eye specialists, especially in rural areas, inadequate number of specialized nurses, lack of universal clinical guidelines, the high cost of retinal procedures and intraocular lenses, and the legal aspects of corneal donation. Some other areas identified for focused attention are improving outcomes and quality, reducing cost of eye care, and pursuing innovation. Distinguished delegates, just as lifestyles have changed with the changing times, we are also witness to how technology is impacting every aspect of human life. Immersed as they are in material pursuits, people tend to often ignore their health and the imperative of preventive care. And when they are confronted with a medical problem, they expect instant relief. The resultant complications require quick response, as also immense patience on the part of the medical practitioners. It is therefore necessary that the different branches of medical science keep pace with the emerging dimensions of health disorders. Needless to say, ophthalmologists also have to keep these aspects in mind at all times. An effective strategy will be to put Your highly specialized medical training and knowledge about preventive measures and medicines to the best use to educate and awaken our vast multitudes about the absolute necessity of eye care. Coming to our own country, according to the 2011 census, there are 50,32,463 visually impaired persons in India, with the impairment of much higher in rural areas. Of course, ophthalmologists and eye care practitioners have a different set of figures, with some experts pointing out that 1 out of every 3rd blind person in the world is an Indian. What is even more worrying is that the maximum number of visually impaired persons comes under the age group of 1 to 19 years. The population of visually impaired people is likely to rise to 15 million by the year 2020. All these dismal figures stand out in stark contrast when you look at the fact that India was the first country in the world to launch a national-level program for control of blindness 40 years ago in 1976, with the avowed goal of reducing the prevalence of blindness. While the single biggest cause of blindness in India is cataract, refractive errors come second, followed by glaucoma. India needs to work on more eye specialists and trained nurses, augmented infrastructure, enhanced nutritional status, and vastly improved hygienic conditions. I would also like to mention about the fast increasing incidence of diabetes in the country and its negative impact on eye health. Your website aptly recommends that we should focus more on the diabetic population, as diabetes can cause blindness. Community awareness campaigns can go a long way in addressing all these problems. An important issue that arises here is in the larger context is the varied constraints that hinder our efforts to provide universal health care. We all recognize that it is extremely unaffordable to avail the benefits of new advances in eye care for the marginalized and deprived segments of the population. We cannot deny the fact that it is beyond the reach of the poor and the needy to be treated satisfactorily, because treatment, both preventive and post-disease, is costly and treatment facilities are sparsely located. How do we deal with such a sorry state of affairs? Can we claim success in extending universal health care when around 60% of our brethren cannot afford it? I am well aware that the role of government is crucial to correct the situation. Our parliamentarians have been deliberating on ways to further strengthen our strategies to extend medical care to those brothers and sisters who are at the periphery. But you will agree with me, our efforts have been far from successful. Can we allow this situation to persist? Can we afford to neglect their pain and helplessness? All stakeholders will have to acknowledge that there are serious societal consequences of such a situation. The government has to reach out to the people, which is its primary duty. But each one of us, more importantly, medical practitioners, owes it as a duty and responsibility. It needs reiteration that medical research is one area that needs a boost in our country. How should we strategize our efforts to ensure that medical research is well focused to provide a momentum to achieve sustainable eye care for all our people? While significant policy interventions are necessary, it is also the need of the hour that our researchers are motivated enough to give their best. There should be more opportunities for their career advancement and professional development. Our public investment also needs to be strengthened. Can we survive as a nation with less than 5% dedicated provision for health services in our planned outlays? The insurance agencies, including the private ones, need to be motivated through a combination of legislative and other policy intervention to reshape their priorities so that the market strategies result in more engagement with the poor. It is our moral duty also that we innovate health insurance premium liabilities of the poor in such a way that it leads to an equitable and sensitive opportunity for the poor. In this context, one may be reminded of what Helen Keller said, and I quote, "My darkness has been filled with the light of intelligence, and behold, the outer day-lit world was stumbling and groping in social blindness." Unquote. Let us pledge not to fall prey to such social blindness. As we endeavor to achieve sustainable eye care and health in line with the Vision 2020 and the right to sight, it is necessary that the existing and developing additional human resources and infrastructure facilities are strengthened for providing high-quality, comprehensive medical intervention for preventing eye care. For preventive eye care, we have to create awareness about personal hygiene, facial cleanliness, eye diseases, and management amongst patients, their family members, community, and health personnel. Special emphasis needs to be laid on the child side, as child blindness is posing a major challenge. We have to involve schools, Panchayati Raj institutions, and voluntary organizations to educate the people on eye care in general and child health in particular. Since visual impairment figures are despairingly high in rural areas, we have to focus attention on eye care awareness among the millions of rural Indians. It is also important to dispel misconceptions and myths relating to eye donation so that we could motivate more people to place their eyes. We have to look at the employment figures of the visually impaired, enable website access, provide audiobooks, and strengthen the National Talking Book Library. This important conference should acknowledge that treatment of diseases, most particularly eye-related complexities, is not confined to the advanced domain knowledge, proper diagnosis and medication. It also requires proper understanding of social realities, our social obligations, and above all, the plight of the vulnerable who are at a disadvantageous position to benefit from specialists. Let us recall what Helen Keller said, and I quote, "While they were saying among themselves, 'It cannot be done,' it was done." Unquote. We have to work together to ensure that it is done, and the community ophthalmologists have to show the way for it to be done. I'm sure this conference will dwell at length on diverse aspects of eye disorders and the capabilities to sharpen professional knowledge base to deal with them. Thank you for your kind attention. Thank you.